Knock, knock, knock. First, I'm going to wash my hands, put my gloves on. Hi, my name is Peyton. I'm a nurse practitioner doing your cranial nerve exam today. First, I'm going to have you close your eyes, and I'm going to test your olfactory nerve. I'm going to have you tell me what you smell here.
Vanilla. Cinnamon.
Good. Next, I'm going to test cranial nerve number 2, your optic nerve. I'm going to have you read the lowest line that you can.
P-E-Z-O-L-O-F-T.
Your vision is 20/20. Next, I'm going to test your visual field screening. I'm going to have you look straight ahead and tell me when you see my fingers.
No. No.
Okay, and close one eye.
No.
Okay, and the other?
No.
Good. Your visual field is intact. I'm going to use the ophthalmoscope and I'm going to look at your optic fundi. I do note that it is round. I don't note any hemorrhaging. Next, I'm going to test cranial nerve number 2, your optic nerve, and number 3, your ocular motor. I'm just going to assess your pupils. I'm going to note the shape and the size, and then if they react to light. They are 2 milliliters each, and they're round, and they both react to light. Next, I'm going to see if they accommodate. So I'm going to be looking at my finger and look off in the distance. And come back. And they do accommodate. Next, I'm going to test your ocular motor, your trochlear, and your abducens. That's cranial nerve 3, cranial nerve 4, and cranial nerve 5 or 6. And I'm going to do this by having you look straight ahead and follow my finger. I'm just going to test your extraocular movements here. And I don't notice any lag or nystagmus. Next, I'm going to see if they have convergence. I'm going to have you look straight ahead. I'm going to have you watch my finger into your nose. Good. And they do have convergence. Next, I'm going to test your cranial nerve number 5, your trigeminal. First, I'm going to palpate your temporal. Any pain?
No.
And your masseter.
Okay.
And I'm going to have you clench your jaw and move it up and down. I do note a strong contraction there, and I don't notice any popping of the jaw. Next, I'm going to test your sensory. Have you close your eyes and tell me where you feel this and if it's sharp or dull.
Dull on my forehead. Sharp on my left cheek. Dull on my chin. Sharp on my right cheek.
Sensory is intact. Next, I would test your corneal reflex, and I would do this by bringing down the eyelid with his eyes open, and I would just take a cotton tip and put it, or cotton swab and put it under there and see if there's a reflex. Next, I'll test cranial nerve number 7, your facial. So here I'm going to have you raise your eyebrows, have you squint, and close your eyes really tight, and don't let me open them, good, and frown. And puff your cheeks out and stick your tongue out. You're getting really stuck here. There you go. Alright, so your facial nerve is intact. Next, I'm going to test cranial nerve number 8, your acoustic. So I'm going to perform the whisper test. I'm going to move my finger in this ear, and then I'm going to whisper on this side and just tell me what I'm saying.
1, 2, 3.
Good. And then on this side.
Have a good day.
Good. Your acoustic nerve is intact. Next, I'm going to test cranial nerve number 9 and 10, which is your glossopharyngeal and your vagus. So here I would first assess your voice, the tone of it, and you do have a soft voice, and I don't notice any hoarseness. Next, I'm going to use my pen light, and I'm going to have you stick your tongue out and say ah. Good. And I'm just looking at the soft palate and the pharynx. And next, I would perform the gag reflex as well. Next, I'm going to test cranial nerve number 11, which is your accessory. So I'm going to have you shrug your shoulders up for me and resist against me. Good. And have you turn your head one way and resist against me. Good. And the other way. Resist against me. Good. Next, I'm going to test cranial nerve number 12, which is your hypoglossal. I would be assessing and inspecting the tongue. I note if it's symmetrical, deviated in movement and strength. So I'm going to have you stick your tongue out for me, and put it back in. Sorry, just open your mouth. And I do note the tongue is symmetrical. It's not deviated. Now you can stick it out for me and move it side to side. Good. And it is strong in movements. All right, next I'm going to test your coordination. So I'm going to have you test your upper extremity coordination. I'm just going to have you take your hands and go hit it like on your thigh and then on the back as fast as you can with one hand. Good. And then your other hand. Good. And now I'm going to have you follow my finger. You're going to touch my finger and then touch your nose. Good. And with your other hand. Your upper extremity coordination is intact. Next, I'm going to test your lower extremity coordination. So I'm going to have you lift your foot up for me. Just bend your knee up for me. And then hit my hand with your foot. Over here.
Move it.
And your other leg. Good. And now I'm going to have you bring one leg up, and I'm going to have you run your heel down to your ankle. And then on the other leg. Good. Your lower extremity coordination is intact. And now I'm going to have you stand up for me. Alright, I'm just going to have you walk. You're going to perform the tandem walk. You're going to walk at me and then turn around and walk the other way. And I'm just noting your posture, your arm and leg swaying, and your balance, and it is intact. Now I'm going to have you walk on your heels. And again, I'm noticing your balance and your posture, and walk on your toes. Good. All right, can you hop up and down for me? Good. All right, you can come here. Next, I'm going to perform the Romberg test. I'm going to have you put your feet together and close your eyes. And I'm just going to hold my hands out and make sure you don't fall. And I'm just noting your balance and coordination, making sure there's no swaying around. And I'll do this for about 20 to 30 seconds. Okay, you can open your eyes. Lastly, I'm going to perform a pronator drift exam. So I'm going to have you stand with your arms out and your palms up. And I'm going to have you close your eyes. And we're just going to slowly lower your hands. And I don't notice any swaying or balance, imbalance, or movement.